The North American Menopause Society is really the go-to place to inform practitioners about the latest science of the menopause. So it's an evidence-based society. And when people think about menopause, they oftentimes think about vasomotor symptoms. And when they think about vasomotor symptoms, they think about, what do I do about them? And do they mean anything in terms of my well-being? Two of the largest contributions that our society makes to the field, and also to women, is that we review all of the data available about the safety of options for vasomotor symptoms. So we really categorize these in two camps. One is hormone therapy, and the other one is non-hormonal therapies. So one of the highlights of this year's meeting is that we launched the position statement for hormone therapy, reviewing all of the evidence and proposing a major shift from this focus on the lowest dose for the shortest time period to one that says we need to think about the appropriate dose, the appropriate regimen, in individualizing treatment for women. In addition, and equally important, we have, under the leadership of Janet Carpenter, reviewed all of the data related to alternative non-hormonal therapies for vasomotor symptoms. Hormone therapy is the gold standard for the treatment of hot flashes and night sweats. Nothing else works nearly as well, but many women don't have that option or choose not to take it. And so then the question is, what do we do about that? So our review of the evidence for non-hormonal therapies showed that there are many options that are evidence-based from randomized, well-conducted trials. And these include things like SSRIs, SNRIs, gabapentin, clonidine, cognitive behavior therapy, hypnosis. These options are very exciting. They don't help as much as hormone therapy, but they are evidence-based. And then we have a few new things on the horizon. One is an anesthesia procedure called stellate ganglion blockade. It's used for the treatment of pain, and in the first sham-controlled clinical trial led by David Waliga at Northwestern University, I happen to be on that study as well, showed that this anesthesia procedure lowered the rates of moderate to severe hot flushes by 50% compared to a sham control. So that's exciting, and we just got funding to do a larger trial. Another option is S-equal. So at this meeting, Ken Setchell gave the Wolf-Udian lecture and discussed the science of soy and the possibility that S-equal, in particular, a soy derivative, has some beneficial effects on hot flushes. So we're awaiting clinical trials, but that's another one that's coming down the pike. I recommend that anyone who's interested in this topic, that should be anybody who's treating women between the ages of 50 and 65, consider going to menopause.org as a resource for evidence-based information. We have information for practitioners, for patients, and for the public. So go to our website and see what you can find to meet your needs.